Welcome to RevMD, a podcast created for healthcare professionals by healthcare professionals. We will share tips on medical billing and coding, as well as workflow optimization to help practices succeed, thrive, and grow revenue. All right, let's get started. So today I'm going to demystify the claims process. Even if you have a team of billers, whether they're insourced or outsourced, I really want to emphasize how important it is for you to understand the entire process so that you understand your workflow, things that may or may not be working, and then how to work through the data that you're going to be regularly checking so that you know what's working and what's not working. So let's go to the first slide. So for practices to ensure that their claims are paid, they must fully, truly understand the different components of the claims management process. So we're going to walk through those steps today, which start with patient registration, go through insurance verification, coding and charge entry, claim submission, AR payment and posting, denials management, as well as then reporting and data tracking. Each of these steps I'll kind of briefly touch on. Also kind of give little tips of things you can do in your practice to help make sure that these are done well. If you're looking at this today and you don't currently today look at your data for your claims and look at how that's going, I highly suggest that be your number one takeaway, is to go to your in-house or outsourced biller and say, hey, I want to look at my claims data. Let's look at it and see how we're doing. Tell me and teach me about it. If you don't have a medical biller or a team that is willing to do this, please consider switching. Reach out if you need help. I think that it's one of those things that you just need to have a pulse on. So if we go to the next slide, let's first talk about patient registration. So this is the first step in the medical billing process, which really involves collecting data and getting the information you're going to need in order to do that insurance verification. So that's your patient demographic information, right? And we've got to make sure that not only is this captured up front, obviously, but it's also something that we review every time the patient coming in, even if it's just a brief double check that this is your information and this is accurate. Obviously, more important for any new patient, right? But again, we want to have that as part of our process to regularly check that in the office. If there's a way to do a more detailed review at an annual basis, really, again, double checking that the insurance information is correct, address, phone numbers, et cetera, that is also important. So if we go to the next slide, this is really the insurance verification piece. And I highly suggest that this is something that should be done up front, right? We shouldn't be doing this after the fact or after the patient visit. So we want to make sure that, we're verifying policy benefits and eligibility, that we're understanding, how much the copay and deductibles may be for the patient, and that we're collecting that information when the patient checks in. So all of that information should be collected and paid up front. If you need to do a prior authorization, we should be obviously doing that ahead of time, understanding if we need to do that, and then working through that process so that when the patient checks in, all of this information is done as much as possible, recognizing that there's some things that come up in a visit that, don't make that 100% possible. But for the most part, for most clinics, that should be something that should be able to be done. All right, let's move to the next slide. After the patient has had their visit, right, the physician or the provider documents in the chart, they document all the things that occurred, the assessment, the plan, et cetera. Now it's all about accurate coding and charge entry. And so we've talked a little bit about ICD-10 codes in a previous podcast. And the important thing here is that your ICD-10 codes are specific, they're accurate, and they're represented based on the documentation in the chart. Also, it's important to add anything around time that you spent with the patient, especially if you're planning to use any of the extended time CPTs, which we'll go through in another podcast. Of course, only do the extended CPTs if it actually makes sense clinically and it's relevant to patient care. Once the codes are entered, then charges will be dropped. These are what will be submitted by the medical billers for reimbursement. And it's important to remember to review your fee schedules on a regular annual basis to make sure that your fees are set appropriately without, of course, over or undercharging. And so typically this is done by reviewing your contracted rates for both Medicare and private payers, and then setting your rates as a multiple. Any error can result in a rejection. So your goal is to have 95% of your claims, submitted and not rejected for any errors. And so it's important that, up until now, right, the patient registration, the insurance verification, the coding are all accurate so that you don't have a claim rejected for any error. And of course, like I've said before, as a physician, you are responsible for accurate ICD-10 codes and CPT coding, even if your team is doing it for you. All right, let's go to the next slide. Let's talk a little bit about claim submission. Again, this is not typically something that's done by the physician or the provider, but it's critical for you to understand how it works so you can implement things in your practice that help improve revenue capture. So typically claim submissions happen electronically through the practice management software through the electronic data interchange, the EDI. So the claim is then reviewed at 3 different points. The first is through the EMR, which is looking that the fields are complete and that everything is filled out. Then the clearinghouse, so that next step, responsible for the EDI, will perform a check on the patient information to confirm that the patient and the date of birth are correct, that the policy is active, and that there aren't any coding errors that they can tell. Then the last checkpoint is actually going to be with the insurance company, where they perform that same check as the clearinghouse. And if any error is found in any of these steps, it's going to be rejected. So getting past all of these 3 checkpoints gets you to a clean claim submission. And that should be kind of in that 95% range for your office. And yes, if you aren't already checking or understanding what your clean claims rate is, you need to do that. So again, any error or rejection at this point will come from missing patient information, inaccurate information regarding the insurance coverage or active policy, or not following a payer guideline. So if we go to the next slide, let's talk a little bit about accounts receivable or AR and then payment posting. None of this is done by the physician. This is all done by either your in-house or outsourced billing team. But it's, again, another important part to understand. Your accounts receivable is really that process of understanding, was there a patient payment or an insurance payment that we need to post to the account. Of course, fixing any errors that have been identified. Now, if the insurance paid the claims, then they post these payments and funds are released either in the form of a check or fund transfer. And this often occurs in bulk payments, and it's unfortunately not always immediate. It's, takes some time. This is where the explanation of benefits or EOB or electronic remittance advice, ERAs, are reviewed and make sure that those are all accurate and appropriate. Oftentimes, this is all put into your project management software, and that's the ideal state so that, your EMR and your billing are all in one place so that you can look at the data, you can understand what's going on and help make changes if the process isn't going well. All right, so let's go to the next slide. Let's talk about denials management. Denial management is really, again, handled by your billing team so that any, denial is followed up on in a timely manner. And this is absolutely key. And you should be able to also track, the timing around how long it's taking for your billing team to at least start following up and resubmitting things. This is kind of the most time-consuming part. It's a rigorous follow-up with the insurance company, basically collecting information related to the denial, investigating and coordinating so that you can maintain payment flow. They may need to correct information regarding the CPT codes or ICD-10 codes or the insurance information so that they can prove that they need to get paid, essentially, or that you need to get paid. The billing team is also going to maintain any correspondence with the insurance companies, which again, time consuming. This is also the time to identify any process gaps so that denials in the future can be reduced. And this is, again, the hardest, most time-consuming part. Very important to have this be timely. We shouldn't have denials sitting out there for 30 plus days. I mean, it should be, hey, you get a denial, I'm following up with that immediately. That way you're constantly keeping that flow of information going because oftentimes these denials, it's a lot of back and forth. And so it's important to kind of stay on top of them. Let's go to the next slide. Reporting and data. I talk about this is our fourth podcast, multiple times, right? It is so important that as a physician, as an owner of a practice, that you understand what data is and is possible with regards to your practice management software so that you can identify gaps, identify things that aren't working well, identify your clean claims rate. So maybe you see that your front office staff isn't doing the insurance verification and you're getting a lot of rejections because the insurance isn't active. These are the sort of things that this data helps you identify and then change processes. If you aren't looking at this data today in your practice, the number one thing I want you to take away from today is that you need to go find the data, sit down with your billing team, and get familiar with it. If you don't have a billing team ready or willing to be able to sit down with you, then it may be time to make a change. Last slide is really just to summarize things and proactive tips that you can put into your practice today. I want you to make sure that every single one of you evaluate your verification process, ensure that you've got clean claims, look at those clean claim rates so that you can make sure that that piece of the puzzle is going well. Next is really minimizing any coding errors, understanding the coding differences between physicians if you've got multiple providers in one practice can also be very telling. And we'll kind of talk a little bit more about this in a talk just looking at data, but really understanding, well, why am I always billing a level 3 when my peer is billing more level 4s? And if you're seeing the same type of patients, maybe there's a discrepancy on who should be billing what. Also want to make sure that you're minimizing any ICD-10 coding errors, making sure that you're being specific with your ICD-10 codes, really making sure that your billing team is staying on top of any timely filing and any resubmissions that are necessary. So as a practice owner or physician, you should stay informed in the office process, track the data so you know when something needs to change. My last request is if these podcasts are helpful to you, please find 3 other new in practice physicians or medical residents that maybe need a refresher in medical billing and coding. And as always, come join the Facebook group RevMD, REVMD, and look forward to talking about E&M codes next. Thanks for joining today. We are starting a movement. If healthcare professionals understand the complexities of medical billing and insurance reimbursement, we can be advocates for our patients and grow our own revenue. If you like this podcast, share it on Facebook and invite others to the Facebook group RevMD.